Welcome to season 11 of the Social Work Rants podcast, providing an inside look of the social work and mental health profession, continuing to discuss social work entrepreneurship, social work being political, and the day to day aspects of the social work profession. Hope you enjoy. Hello, social workers, mental health professionals, and change agents. Welcome to another episode of season 11 of the Social Work Rants podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to follow the podcast on Instagram at the Social Work Rants podcast. Hit that red subscribe button on the YouTube. However, you listen to podcasts, definitely download episodes, share episodes, leave comments, rate the podcast. You can rate on Spotify and Apple Podcasts if that's your listening preference. So, shout out to everybody who's been tuning in. There's a lot going on. I hope you're staying informed by listening to or watching the podcast, and it's giving good info, especially, and it's good to listen to podcasts as a form of self care. So, um, that being said, I know a few weeks ago I did a episode of the Big Beautiful Bill before it got passed and what it means for social work. Now that it passed, uh, what's next? What can we do? Because it's official. July 4th, known as not election day, Independence Day. Even though it was for me not in the mood to celebrate Independence Day this year, thanks to the president signing this bill. Is quote unquote the big beautiful bill should be known as the big tragic bill or disgusting bill because there is very few benefits in this bill from what I've read and what I've seen on the news and on social media, like the breakdown. What does it mean? Um, so basically, what what can we do? So before we get there, let's talk about what a breakdown of the bill. Again, you could go back to the last podcast episode, Big Beautiful Bill and Social Work, and then so this kind of be like part two uh, of this bill. Now that it passed a few weeks ago, immediate effects includes ICE and Border Patrol boosts. A lot of money is going into ICE agents, unfortunately. Um, Expanding work requirements for SNAP. That's going to affect a lot of people. Um, I definitely see people who are disabled who are on SNAP, probably getting cut off of SNAP, and then they gotta fill out the whole application for SNAP. If you don't know what SNAP is also for food, it's food stamps. Um, and sometimes you get cash assistance with that as well. So a lot of people are going to be affected. A lot of people are going to get, cut off from SNAP benefits. Medicaid's the big thing. At least 17 million Americans are in danger of having their Medicaid being cut off, which leads to, especially in rural areas, but also major cities, losing hospitals, losing income, money that they get from Medicaid, and so that could lead to potential job losses. And New York, you know, America really is going through among many crises. Still haven't. I feel like the healthcare system hasn't fully recovered from the pandemic. So a lot of doctors, it's hard to get. appointments if you try to get primary care. I know in Delaware is like for anything, try to get the doctor's appointments, um, or even like dental or specialists, like even like dermatologists, or even the only thing I've seen you kind of get a pretty fast appointment if you want to get a vision test done. So, but everything else is really hard, and even like I've seen doctors doing a subscription based model service, having their own private practice, and you pay a monthly subscription, and you see the doctor, and then you have access to them like text messaging, email, give you results, and you can go back and forth talking to doctors, and that's how doctors are trying to make their money because they're not getting paid by the insurance companies the way they should. So, um, for those of you who still have student loans, I've done many episodes regarding student loans, but student loans are definitely getting complete kind of overhaul. So I want to get into that. Student loan repayment plans are being replaced. You must switch by July 2028. Um, Pell Grants eligibility is tightened. Borrower caps are lower. So if you're trying to go to grad school, for my DSW folks, it's going to be harder to find that loan money for you to get your DSWs or anything post masters is going to be even difficult. So there's constant changes regarding the student loan payments. If you're on the SAVE program, that's pretty much dead. Uh, so I would suggest following two podcast guests who are experts in student loans. Robert Farrington, better known as the college investor, he was on the podcast uh, a few months ago. And then late last year, I had Dr. Sonia Lewis, better known as the student loan doctor. She got the inside track, or at least she did, with the White House. So she was always up to date with student loans. So I would suggest if you still have student loans, those are the two main people for you to follow on Instagram. Um, yeah, so there's going to be a lot of changes regarding student loans. Obviously, we touched on the SNAP, the Medicaid, uh, out of pocket expenses for Medicaid recipients are going to be increased. Obviously, if you get cut off, more out of pocket expenses regarding getting medicines and just seeing the doctor, co-payments and stuff like that. Um, if you're trying to get an EV car, you're not starting in September. The vehicle tax credits are going to expire. So if you're trying to get a Tesla, you try to get any hybrid model car, those tax credits are going to be gone. Anything related to house, uh, energy efficient stuff regarding the house, that's going to get cut supposedly as well. Um, those of you who, especially my social work entrepreneurs, this is for you. ACA premium tax credits expire December 31st of this year, so the last day of the year. So if you had ACA and ACA um, is, I know Trump has been fighting to get rid of ACA period, so that's always on the table. But these premiums are going to go up. Um, your monthly is going to go up under ACA, and obviously with no Medicaid and there's still a potential Medicare cuts that obviously that's going to drive up the price for having ACA Obamacare marketplace insurance. And I always like to use that terminology interchangeably because right after the election, people was like, oh, my insurance is gonna be cut off because they didn't think Obamacare and ACA were the same thing. So if you have Obamacare, you have ACA, you have Marketplace insurance is all the same thing, and those tax credits are going to expire at the end of this year. So your for 2026, your ACA premiums are going to go higher, and is already expensive as it is, especially if you're single, not married. You get a tax credit if you are married, but for my single folks out there, expect to pay more regarding ACA payments, and that is big. Um, any green energy tax credits are going to expire. Uh, SNAP Ed nutrition and obesity prevention programs are going to be defunded. So Trump wants to make more people sick and be unhealthy. Um, I saw any like neurodivergent programs for schools that's going to get cut as well. So for all my neurodivergent folks out there, to be on the lookout for that as well. So ADHD, ADD, fetal alcohol syndrome that doesn't get talked enough about. I've done a couple of episodes about fetal alcohol syndrome, FASD. You can't. That's a diagnosis that you can't see physically. So a lot of people don't know about that. So all those type of programs are going to get cut as well. Um, July 1st of 2026. Like I said, going back to the student loans, but there's a lot of changes starting January 1st of July 1st of next year regarding student loans, repayment plans being replaced. To 2027, October 1st, 2027, SNAP funding force onto states, and new caps on state Medicaid provider taxes. Um, so yes, so the federal government wants the states to handle all these things. That's what they can't. They're trying to get rid of um, the Department of Education. So a lot of these decisions are going through the states. So if you live in a red state and education's poor, is going to get worse. Um, just at education, I've been at nauseum about talking about education in this country, and I do not envy school social workers within the next couple of years is going to continue to work with all these changes that are are happening, and that's going to affect kids in school. January 1st, 2027, new Medicaid work reporting and eligibility reapproval requirements are going to take place. So again, we're going to have a lot of people, struggling to prove like they cannot work and have a reason for not to be working in order to have their benefits that they've had. So, um, and of course, a lot of these things are going to be taking place after the midterm election of next year. So Republicans think they slick and be like, yeah, we signed off on this, but vote for us anyway, because nothing changed. They think they so slick, and changes are going to come after the election, so they're going to bank on them getting reelected, and then all these changes are happening, and then and bank on not having an election for 2028. So Um, so, so just be mindful where to get information from. Uh, this is just some of the things that are happening that's going to affect our clients, uh, affects those of you who have Medicaid clients, and build Medicaid or work at a hospital, do case management that you build Medicaid for senior clients. I would suggest, if you haven't done so already, speak up at your jobs if you feel comfortable to. I know there's a lot of agencies or companies that are like, yeah, I'm just gonna go with the flow and not say anything or cause a ruckus. But if it's affecting you personally and it's affecting, or is going to affect your work one way or another, and your agencies haven't had this type of conversation yet, then I would suggest you should bring it up in one-on-one supervision. There's uh, EAP programs that a lot of companies offer. If you have a therapist, go talk to your therapist about it and share your feelings about that. Um, what if you build Medicaid, how you're planning to somehow get that income that you're going to lose by might not you might not having to build Medicaid anymore. How you going to get paid? How you going to pay your clinic bills if you have a clinic and private practice, and having Medicaid clients? Are you still going to see Medicaid clients, or you just not going to bother? So there's a lot of these things that people in private practice are going to be dealing with. Or those of us who work in case management, care coordinators, um, intensive case management programs that are build Medicaid services. Hospitals have all my hospital social workers start having these conversations in these staff meetings. If if you the company hasn't brought it up yet, because you need to know what the higher ups, what administration is thinking about. That way, if you need to make a move because you know you're in danger of maybe having some layoffs or possible closures as a result of all these things, losing Medicaid dollars, then you as an individual may need to make a move and find a new job. So there's a lot of variables, there's a lot of factors into all this, but conversation needs to be had. I know where I work at currently, they already started having these conversations, and at least letting staff know that the company's in a good shape for now. Could that be better? Absolutely. Like a lot of places, which they should be better at. But so far, so good. At least there's some relief right now from where I'm at. But uh, you can never be too comfortable. 2020 proved that you can't be comfortable anywhere at a job. So no such thing as job security. 2020 proved that. There's no there's not a lot of loyalty. So unless you work for yourself and you have your own business. So um, yeah, so just some of the things for you to think about, and also I would suggest you start, um, if you have not invested in the stock market, start learning to, uh, and start paying attention to these companies that are getting these federal contracts, and just kind of like pay attention to what's happening. If you are investing in the stock market, this is not financial advice. However, just pay attention to certain companies that are leading the way in terms of AI, leading the way that the government's giving money to. Um, and obviously, you could invest in companies that are got nothing to do with the federal government. If you you know, or if you bothered of what's uh, certain companies having relationships with the current administration. But if you want the dough, you want the money, then pay attention to some of these companies because there's some heavy hitters out there. So I was definitely at least um, learn the stock market and get into it. Um, there's still real estate to get into. Um, Obviously, certifications in terms of AI and stuff. You may have to make a pivot and somehow related to social work. So there's a lot of things to think about because a lot of things that are happening in real time, real fast, and this administration be distracting folks about certain things where we should be continuing to talk about the main issues that affect us in the profession, going to affect our clients, affect our communities, and he's bobbing and weaving like a boxer. Like, look over here, no, look over here, look over here. It's like two or three things like happening in one day, and it's just nothing but distractions. So, um, and protect your peace above all. Like, everybody's situation is different. Everybody's financial situation is different. That's why it's called personal finance. Uh, your personal finance is not is definitely different from your mom, your dad, your sisters, brothers, cousins. So um, yeah, do whatever works for you, but definitely keep. And there's still that fine line of keeping informed without bugging out, for a laugh, for a lack of a better word, and not feel overwhelmed, stressed for what is happening in the U.S. and around the world too. There's still issues with Iran, still uh, beef with Russia. There's all kind of genocides in Gaza and in African nations as well in the Congo. So it's a lot happening in real time. So I hope I gave you some good information. Try not to ramble too much. And yeah, continue to subscribe, download episodes, share episodes, leave comments. Shout out to everybody that's been subscribing to the YouTube. Um, Over 300 and drive to 400 subscribers on the YouTube. So, um, and yeah, shout out to you for listening, and we'll continue to bring episodes throughout the summer. So if you're on vacation, you going somewhere or staycation by the beach, pool, definitely grab some headphones, some earbuds, and listen or watch the podcast. I appreciate all the love. Till next time, peace.